I'm just going to give you a very brief guideline and a few indicators about when to see the dentist or when to call the dentist. Obviously there's the business of checkups, which I think we've covered in another talk. And for most people, every 6 months is appropriate. I would just say that if somebody's only got dentures, they've got a full set of dentures, then every 12 months is sufficient for them, just to check the soft tissues. But for most people who've got their own teeth, every 6 months is appropriate. The other reasons to call the dentist, of course, are when you've got pain or problems. The most common situation being toothache, severe pain, or any swellings that occur on the gums or in the jaws. And obviously that's an indicator that you need to call the dentist either for yourself or the person in your care. In a care home setting, it will be common to see bleeding when you're brushing one of the residents' teeth, and often bad breath can be associated with that too. So a bit of bleeding or bad breath tends not to be an urgent situation and doesn't usually require the dentist to be called with any urgency. The reason that you're seeing that bleeding or smelling the bad breath is due to the advanced gum disease that is really common later in life, and it's just part of the aging process, especially for many of the residents who are a good age in a care home. Things to look out for that do require you to call the dentist would be situations such as broken teeth or broken fillings, particularly if they're causing sharp edges which can really lacerate the cheeks or tongue. If it's a broken tooth that's not painful, then there's no urgency. The dentist can be called, but 3 or 4 weeks later is not a problem. It just depends if it's actually causing pain. The other reasons to call the dentist, I would say, are loose teeth. Again, this relates to the gum disease, but teeth can often become painfully loose, usually requiring extraction. And the other reason to call the dentist would be if a denture becomes painful, which can also cause a great deal of pain and is a common situation in care homes as well. This has just been a very brief idea of when to call the dentist. Most situations are self-evident and you'll know when it's necessary, but the thing to look out for most of all is a swelling, as that could be more life-threatening and more serious.